Well, it's my privilege to introduce Professor Horst Spielmann from the Free University in Berlin. He's going to begin the session on systems biology approaches and predictive toxicology. I have a special warm place in my heart for the Free University in Berlin. I had a chance to do a mini sabbatical there back many years ago, actually in '89. So it was a very important year for Germany and a very important year for me to be there. So Horst?
First I have to find my slides. Can you help me put it on? They just left. Oh, no, thank you. Thank you for inviting me, and I want to thank Thomas for giving this nice overview. I have to say just up front that I am both, as far as it's possible, a scientist developing new assays, and at the same time I've been a regulator before I joined or got the position of being head of CeBIT, the first center in the world, government center to develop alternatives. And our major challenge was we developed, to add to this, I coordinated validation studies. That's what Thomas is missing at the moment, that new assays are developed. How can we then introduce them into the regulatory arena, getting them accepted by regulators? And since I worked in an environment, in a regulatory institute, having been a regulator myself, we always asked ourselves, how can a regulator use these new methods? And I think the ITS is one approach to do this. And as you can see, the idea using integrated approaches, meaning combining in vitro assays and existing in vivo or other assays, started already in 2002. Even at that time, it was discussed at the OECD, and later in the institute where I worked at the BFR, ECVAM came up with a proposal, a workshop to use, as Thomas indicated, top-down, bottom-up approaches. Of course, this idea, we had the ideas and the Americans came up, we are only accepting if you give the term bottom-up, top-down. It never occurred to us. So that was basically to that, the American contribution. ECVAM then had in 2009 and 2012 two workshops on the validation of integrated testing strategies. And finally, Thomas referred to this, in 2014, the OECD came up with a special integrated approach for skin corrosion irritation. I should say that, as you may know, the first in vitro assays were developed in the skin and eye irritation area because we had the EU Cosmetics Directive just to please them. But we didn't, and our challenge was to integrate in vitro methods into the regulatory acceptance for making decisions on hazardous chemicals. And then I want to add 2 points, the AOP, which was essential to get a new method for skin sensitization accepted, which was essential to meet the challenges of the EU Cosmetics Directive. I developed an embryonic stem cell test using mouse embryonic stem cells, and Thomas was kind enough in his review on ITS indicating that this essentially also was an ITS. And in the end, I want to refer to the ban on cosmetics, that how did we meet this challenge. So in 2002, this was before Thomas joined ECVAM, we had a so-called white paper. It's the first draft of the EU Chemicals Directive, today called REACH. And at that time, we only tested in Europe new chemicals. And then it was decided we also want to do existing chemicals. As you can see here, it is about 30,000. We estimated 30,000 existing ones. Most of them didn't have any data. We would have had to use lots of animals to meet it, just in order to meet that challenge within a 10-year time frame to test all of them. We said we have to make better use of in vitro methods. So the consequences, we suggested to the European Commission to fund research in the 6th, and I want to make it short, also in the 7th framework program to fund development and validation of alternative methods. And this was our first proposal at an ECVAM workshop, and you can see here what is basically integrated testing. Take into account background data, physicochemical data, existing data from humans, this for existing chemicals, and then ask yourself, do we need any testing or can we classify? If not, if we don't need it, you can go ahead. If yes, you do first some in vitro assays, and then only in the end animal tests. This was the idea at the time, 2002. And just not by chance, in order to get in vitro assays accepted at the worldwide level at the OECD, the head of OECD at the time for testing, Aman Kutta, asked me, can you send an experienced scientist to me? So my colleague from BFR, Manfred Liebsch, spent 1 year at the OECD, and we came up with all kinds of ideas, including the first 4 in vitro assays that were accepted for regulatory purpose at the time, since Manfred and Hermann were very active. And so even then, the OECD, this is an official OECD slide from Manfred, brings up the sequential testing strategy. So the idea was already there in 2002. And this is even in 2002 for the 2 endpoints, skin and eye irritation. This was important for cosmetics. You see, you look at existing human data, QSAR, eye irritation corrosion, QSAR skin corrosion, starting with the severe irritating ones, PhD and buffering capacity, evaluate dermal toxicity, in vitro tests for eye, for skin, and then in the end use 1 or 2 rabbits. That was developed already in 2002, the idea. So it's not something very new. We didn't call it, we called it a testing strategy. And even in the test guideline, as you can see, for eye irritation at the time, there was an integrated testing covering these endpoints, and as I said, in the end, 1 or 2 rabbits to confirm. And we took it back when Manfred came back to the BFR, the Federal Institute for Risk Assessment. And as you can see, he even at the time used this is an OECD slide. I don't want to go into many details, but again, existing human information, QSAR, identification of buffer capacity and so on, and then you can decide at different points, is testing necessary or not, and also decide testing necessary first in vitro and then only in the end in vivo. But here in the BFR we had the idea, if predictive assays for eye and skin irritation, strong, the absence, I didn't mention here that in order to get the test accepted at the OECD level, the tests were only passed to identify the severely irritating ones, not the absence of irritating potential. So we suggested then, if tests are developed that can also identify the absence of an irritating potential on the skin and eye, then we could do these 2 endpoints without testing in animals. And we published a paper from BFR, my colleagues, in which we also said we should include structure-activity relationships, and in our paper we showed that structural alerts for the prediction of potential to cause local lesions and physicochemical limit values, we call them DSS, for the prediction of or absence of such a potential provide testing and assessment strategies which only use QSARs and the results of in vitro tests for regulatory purposes to convince the regulators. And as an example, it says here something about lipid solubility, aqueous solubility, so physicochemical data, and then if the value is like this, then you say yes or no, no testing, and so on. And so basically, at the time, in 2004, this was the official testing strategy at the EU level. You did for skin and eye, skin corrosion, then you did structure activity, then you did eye irritation, and depending on the outcome, you had to go into, for skin irritation, 1 rabbit, for eye, 1 or 2 rabbits. So this was then the strategy for skin and eye, and you see down here, you can classify corrosive, irritant, non-irritant in a similar way with different R values, classification, non-irritant, not corrosive, irritant, and corrosive for skin and eye. So this was the approach, and we suggested the opposite bottom-up approach. I'm sorry. Okay, I'm sorry. So starting here from existing information, then taking into account QSAR, pH, and then depending on the endpoint you want to tackle, physicochemical limitation values, skin corrosion in vitro, and skin irritation in vitro, and the same here for eye. So this was the view at the time, and integrated testing will allow us to identify and classify chemicals for and chemical mixtures for skin and eye irritation without the use of any animals. And believe it or not, at the time when Thomas was there in 2005, Laurie Scott, she was from P&G, chaired a workshop, and as I indicated, our American colleagues at that workshop, we came up with our proposal, suggested the bottom-up and top-down approach that I tried to indicate to some extent. You either start with tests identifying the severe ones or the absence of severe potential properties of chemicals. But the negative thing is it took 5 years until this was published, and I think this is also unacceptable. I always found it unacceptable. We bring our ideas to ECVAM, it takes them 5 years to publish. In not a high-rate journal, it's, I think, Toxicology in Vitro. Usually, if you submit, they accept it. So, I mean, there is a problem. However, meanwhile, ECVAM held 2 workshops overcoming the barriers to validation of non-animal partial replacement methods to integrate the testing strategies, and the second one was the part of the ECVAM workshop on the validation of ITS. So this has then been taken up in 2009 and in 2012. And it's good here, and I don't like to read these things, but I think I have to, because it's about definitions. When we come up with ITS or whatever, everybody comes up with a different idea. So in 2009 it was said, in the context of safety assessment, and ITS is a methodology which integrates information for toxicological evaluation from more than one source, and it gives reference to the 3 R's. And there had been a OCD workshop which also said, and this is common sense, a good ITS should be structured, transparent, and hypothesis-driven. I think this is a wonderful suggestion. And then they came back in 2012, reviewed their proposal, and they came up with 2 views on ITS. They identified type 1 and type 2 ITS. Type 1 ITS covers strategies to gather and analyze a broad range of data coming from different sources and used to draw conclusions based on weight of evidence approaches. This is the one. And the other one is testing strategies composed of a number of in vitro and in silico methods that's combined and weight in a fixed way would serve to replace some or all of in vivo experimentation for a given toxicological endpoint. And if you say we want to validate, it's of course clear what kind of ITS are you referring to? And in that workshop, they also made the proposal, or they identified the requirements for formal validation of ITS. And to make this long story short, there's 2 areas. One is the formal validation of ITS components, and the other one is formal validation of the whole ITS, and validation is only necessary if you want to replace a test for regulatory requirements, and if it's used for regulatory purposes. And so the good news is then that in 2014, and this is quite late now, after several years, the OECD in 2014 accepted or published a guidance document on the composition of the IATA for skin corrosion and irritation. And you can see here that it's, of course, a wonderful flowchart which explains this. And I think due to time constraints, I think I gave you my most important message. And I can, in order to get other areas accepted, like skin sensitization, and we had to include the AOP, but maybe there's time to discuss this. So this was the first concept to convince regulators to accept the new methods, and for skin sensitization, it was the AOP approach which brought in new ideas and a very complex integrated testing scheme that allowed us to, in Europe, to accept as regulators in vitro assays for cosmetics testing. The skin and eye irritation is there important, and skin sensitization. And skin sensitization, as I indicated, could be accepted due to taking up the AOP concept that came from the US. Thank you very much for your attention.
Thank you very much, Dr. Spielmann. We'll have a chance, of course, later for discussions and more questions for all the speakers. So please write your questions down so they'll be ready for that discussion period. Thank you very much for that presentation.